COVID-19 has really changed the dynamics, especially in rural Kenya. Sometimes people think that lockdown doesn't affect people in rural areas, but especially in March when the government ordered a lockdown, the curfew was up to 6 p.m. So that meant people who usually have small businesses, they had to close before 6. And that was very unfortunate because most of the customers, for example, for women who cut vegetables, for people making dinner, we call them mama mboga, they had to close way too early, so that meant they were not getting enough money. Another way that lockdown has affected rural areas like Kitale is that majority of our guardians and parents are casual laborers. So casual work has not been available since lockdown. So majority of our parents and guardians have not been able to work and therefore not able to put food on the table. We have had to reinvent how we reach our families at Neema. So basically, Neema is a development organization, but we've had to change things a little bit and come up with relief efforts. This has included making food deliveries to families, especially because most of our girls, after they were sent home, they reached us and said they were sleeping hungry during our phone conversations. So we thought of new ways to reach them, and we are really grateful that we've been able to do food deliveries since March. Every month we've done at least one delivery to over 20 families.
While we are delivering food, most of the family, not most even, all of the families, they normally appreciate. Some of the cause is that we can meet some families where they have slept without food. So when they see us going with the food, they appreciate. They bless the Neema family.
The new ways of reaching the family that the lockdown has offered us as Neema is through home visitation, where Enoch and I conduct home visitations where we do food delivery, and also we meet with the girls face by face and we do counseling, and sometimes we do phone counseling whereby we do call our girls and we communicate with them. We tell us the challenges they are facing and also the parents.
Tangu corona ianze walitusaidia kuanzia mwezi wa 4.
Because of COVID-19, we nearly went without food, but we have had food since April because of Neema.
Pia nataka kushukuru my sponsors wangu kwa kutuma pesa ili tupate chakula.
I would like to thank my sponsors for giving of their money.
Nataka kushukuru walimu wa shule.
I am also grateful for staff for delivering food to our home.
Kwa kutuletea chakula nyumbani.
We are very grateful to Neema for the food deliveries.
Sababu kama tungekuwa na chakula sijui tungekuwa wapi.
I am not sure what we would have done if they hadn't.
Nashukuru ni kwa sababu ya Neema, ni kwa sababu walinichukulia msichana.
I'm thankful for Neema because they took my girl in.
Alikuwa amekaa nyumbani. So nashukuru Mungu ni kwa sababu
she used to just stay at home, not much to do. She has greatly improved with her schoolwork.
Sai yuko amejiendelesha ni kwa sababu ya kusoma. Hata ni kwa sababu ya nidhamu.
She has also changed and now is disciplined and respectful. I'm grateful that she's taken care of and kept safe.
Nashukuru kwa hiyo. Ni kwa sababu ya kumshughulikia pia. Ni kwa sababu wamenisaidia, ni kwa sababu ya chakula, ni kwa sababu ya COVID-19.
I'm thankful for Neema for the food. I didn't have any way of getting food because of COVID-19. I used to do casual work, but now I'm jobless.
Hata kibarua haiko, so tulikuwa tumekaa hivyo. Kwa hivyo nashukuru Mungu aendelee kuwashughulikia.
Now I'm very grateful to God, and may the Lord bless Neema.
So there's not the usual hugging and greeting. So they keep their distance, and then Irene and Enoch pray with the families. Sometimes the girl needs counseling, sometimes it's the family which needs counseling. So we will actually call our resident counselors and let them know that that family needs follow-up.
Some of the challenges we are facing in this process is that it's raining heavily and the roads are too muddy. Sometimes we encounter challenges at the road. We are forced to walk. I can come out from the motorbike, I walk some distance. When we use the long way, we use a lot of transport due to the muddy roads.
During the time of delivering food, at least it has impacted me in many ways, whereby at least I have known how powerful it is in giving out. So at least to my heart, it has impacted me positively, so that maybe even one time at least I have that heart of giving to other people.
On behalf of the Neema family in Kenya, we would like to appreciate our donors, our grace partners, the tribe, and anyone who has given, especially during this epidemic. Things have been a lot worse than normal. And so we really appreciate those that have been super consistent and really gracious with us and allowing us to move from development to relief efforts, which has enabled us to reach our girls through food deliveries. This has really been vital. If I may give one success story, one of our girls said that if we had not given food when we did, especially in the month of March, she would have resorted to prostitution, which she has done before, in order to put food on her table and to feed her children. And so this has really come in handy, and we really appreciate those that have given to ensure that our girls are not only fed but also safe. We really are grateful to you. Thank you.